Terbinafine cream is used to treat different types of fungal skin infections like ringworm, athlete's foot, and jock itch. It can also be used to treat a skin condition called pityriasis, which causes a lightening or darkening of the skin on the neck, chest, arms, or legs. Terbinafine works by stopping the growth of fungus. It's important to use this medication as directed by your doctor. The usual dosage is to apply a thin layer of the cream to the affected area once or twice a day. It's best to apply the cream at the same time each day for the best results. When using terbinafine cream, make sure to only apply it on the skin and not in the eyes, nose, mouth, or inside the vagina. It's important to clean and thoroughly dry the area before applying a thin layer of the medication once or twice daily, as directed on the product package. Remember to wash your hands after using the cream, unless the area being treated includes the hands. Do not wrap, cover, or bandage the area unless your doctor tells you to do so. Also, do not apply the medication on the scalp or nails unless otherwise directed by your doctor. The dosage and length of treatment will depend on the type of infection being treated. Use the medication regularly at the same time each day to get the most benefit from it. It's important to continue using the medication until the full treatment period is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. It's important to note that your condition may continue to improve after the full treatment is finished, and it may take several weeks after treatment for the infection to completely heal. If your condition worsens or does not improve within 2 weeks for jock itch and ringworm, or within 4 weeks for athlete's foot, be sure to inform your doctor. If you experience any burning, irritation, or itching at the application site, be sure to inform your doctor or pharmacist promptly. It's important to note that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. While many people using this medication do not experience serious side effects, it's important to contact your doctor right away if you have any blistering, swelling, or oozing at the application site. Although very rare, if you notice symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Remember to consult your doctor for medical advice about side effects and reporting side effects to the appropriate regulatory agency in your country. Before using terbinafine cream, it's important to let your doctor or pharmacist know if you have any allergies to terbinafine or other antifungal medications. This cream may contain ingredients that could cause allergic reactions, so it's essential to consult with your pharmacist for more information. If you have any health concerns, it's best to speak with your doctor or pharmacist before using terbinafine cream. If you are pregnant, it's important to only use this medication if it's clearly needed. Be sure to discuss the potential risks and benefits with your doctor. It's not known whether this drug passes into breast milk when applied to the skin. Other forms of this medication can pass into breast milk when taken orally. If you are breastfeeding, consult your doctor before using terbinafine cream. When using terbinafine cream, it's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. To minimize these risks, it's recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of terbinafine cream. If terbinafine cream is swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Remember to attend all your scheduled medical and lab appointments. If you're using terbinafine cream for athlete's foot, it's important to wear well-fitting, breathable shoes and change them and your socks at least once a day. If you're using it for pityriasis, don't be alarmed if your skin color doesn't return to normal immediately after treatment. It may take several months after you've finished the treatment for your natural skin color to come back. If you forget to use your Terbinafine cream, apply it as soon as you remember. If it's close to the time for your next dose, then just skip the missed one. Don't use extra cream to make up for the missed dose. Use the next dose at the regular time. When it comes to storing Terbinafine cream, it's important to keep it at room temperature and avoid refrigerating it. Make sure to store it in a place that's out of reach of children and pets. When it comes to disposing of the cream, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.